Welcome to PBCJ's Morning Coffee Guest. I'm your host, Simone Absalom. This week, we shift our focus to a topic that is likely to have crossed the minds of just about every parent: autism spectrum disorder. The month of April is internationally recognized as World Autism Month, with member states of the United Nations being encouraged to take measures to raise awareness about people living with autism spectrum disorder, or ASD, throughout the world. In just a moment, we'll be speaking with two women who are helping to raise awareness right here in Jamaica. Stick with us. We'll be right back. Welcome back to Morning Coffee Guest. I'm Simone Absalom. This morning, we'll be delving into the topic of autism. With me is Professor Maureen Samms-Vaughan, whose work in child development led to policy and programmatic interventions in the development of Jamaica's national parenting policy, the improvement of early childhood development, interventions to reduce violent and aggressive behaviors, and guidelines on television viewing by the Broadcasting Commission. Welcome, Professor.
It's good to be here.
All right, let's start from the beginning. For those of us who might not know the answer, what exactly is autism spectrum disorder?
Autism spectrum disorder is what we call a developmental disorder. That means that there was a problem with brain development, and that would have happened from when the baby was in the womb, but it sometimes doesn't show up until much later. It is a condition that has three main features. The first is communication. When we communicate, we speak, we understand what somebody else says, and we gesture. You know, they say Caribbean people use their hands very well. And so in communication, in the speaking, some children never speak. Some children speak a little bit later. Some children speak and then stop speaking. And some children speak but in an unusual way. So that's the speaking bit. Then the understanding bit. We expect young children to respond to their name. We expect that when they get to be about a year, we can send them for things. Go and get that. That's understanding when other people speak. This doesn't happen sometimes in children with autism, and when they're older, sometimes they have difficulty understanding what you would expect them to be able to understand for their age. And now gesturing, nonverbal language. We expect children to point. Children point before they can use words because they know what the word means, but they can't actually say it. So children point a lot. And we also do things like waving by, we say come, we shake our head to say yes and no. Those are what we call social cues. But children who have autism sometimes don't understand those cues, or they may not use them at all. That's the communication bit. The next bit is social interaction. Children who have autism sometimes don't play with others as we expect them to. So when they go to preschool, they may just play by themselves rather than play with other children. And even in the home setting, they may not engage with their brothers and sisters, or they may not look people in the eyes as we would expect. Or sometimes they appear a little awkward in their social interactions. And then the last bit is the unusual behaviors that they may have. So children with autism have two groups of behaviors, one called repetitive behaviors and one called stereotype behaviors. In the repetitive behaviors, they do the same thing over and over. Sometimes what they're doing is not actually unusual for a child, but it's how frequent and how intense they do it, like opening and closing cupboard doors or turning light switches on and off. And then the other behavior that they often have is not liking things to change. That's the stereotype behavior. So they get upset if they come home and the chair has been moved. They walk into the room and they scream because they know that something is gone. You, as a mom, haven't even remembered that you moved the chair, but they get upset with changes. They don't like things to change.
All right, so when we say that it is a spectrum disorder, what do we mean?
We mean that not everybody has everything, and not everybody has everything to the same degree. So, for example, I talked about social interaction, right? So there are some children who don't interact with others very well, and way on the other side of that spectrum are children who interact too much. So they go and they hug everybody, which is still not what is typical. And so we have, I mentioned the children who don't speak versus the ones who speak, sometimes speak a lot, but speak on only one specific topic. They always want the conversation to go to that topic. Maybe dinosaurs, maybe space, maybe something in science, but you get that huge variation.
Yes, yes, yes. Okay, I hope no one is going about diagnosing anybody right now with all of those specifics. So what about the prevalence of the disorder? Talk to us about that.
It's really, really common. So right now we get our prevalence disorders because we haven't been able to complete them. We're working on it here, but we haven't been able to complete it yet. We get them from the US, and they do it every 2 years. And last year it was 1 in 59 children. 1 in 59 children is a lot. That's in a small class, in a small school with small classes. That's one child in every other class. In a big school, it's one child. With large classes, it's one child in every class. And if you think about that being multiplied across Jamaica, and 1 in 59 means, with our births about 40,000 per year, means that we have just under 700 children being born with this condition every year.
Are all of them identified?
No, absolutely not. The majority are probably not.
So what if you, as a parent, you see those kind of behavior changes in your child? How do I get my child tested for it?
Okay, so the first thing is that parents should monitor their children's development regularly, and any concern that you have about development, your child's development, you should discuss it with your health provider. Your health provider may be the nurse or the doctor at the clinic, it may be your family practitioner, or it may be a private pediatrician. Whenever you have a concern, discuss it with your health provider first. And let them know all your concerns. They will ask a few additional questions, and then they will determine whether that's a true concern or whether it's just typical development.
And speaking of testing, what separates autism from other developmental issues?
Well, all developmental disorders have their own little characteristics. So, for example, children with Down syndrome are known to be very interactive, whereas children with autism are known to be much less interactive. So, every developmental disorder has its own special little characteristics.
And are we trained locally to identify the ASD symptoms?
Certainly. In the Department of Child and Adolescent Health, where I work, we train medical students. We teach them a lot about the signs of autism, and we teach persons who are already doctors but who are in the training program to be pediatricians, because we need persons to be aware of this condition. It's so common, and it has, long-term effects for individual parents but also for our nation.
All right, stay with us. We're going to be right back. I want to get some more information on that. Well, it certainly sounds like a national conversation as it relates to early detection, and it's headed in the right direction. When we come back, we'll be continuing our conversation with child development specialist, Professor Maureen Samms-Vaughan. Back in a few. Welcome back to Morning Coffee Guest. I'm your host, Simone Absalom, and we're chatting with child development specialist, Professor Maureen Samms-Vaughan, in an effort to raise our awareness as it pertains to autism spectrum disorder, which refers to a broad range of conditions characterized by challenges with social skills, repetitive behavior, speech, and nonverbal communication. Thanks again for joining us. Now, you have made significant contributions to our nation's policies as it relates to equipping our pediatrician with the tools that may help us detect ASD early. Tell us about those.
Yes, this would have happened when I was chairing the Early Childhood Commission. And one of the areas that we wanted to work really well on in the commission was early identification of children with special needs. So in collaboration with the Ministry of Health, we developed the Child Health and Development Passport, which every baby gets at birth. And in that passport, there are screening questions. And those screening questions are for general development. They are meant to identify if your development is slow in any area. So at 6 weeks, 9 months, and 18 months, and again at 3 years, which are the points when we recognize to be really important for screening, there's some questions for parents to ask about their children. You know, is your child speaking? Is your child listening when you speak? Is your child following when you point? So we're asking some very specific questions, but at 18 months, which is the first time that we can really identify the features of autism, we have some very special questions called the 18-month screen. And it says, you know, the question about if you point across a room, does your child follow you? Does your child play and interact with others? So parents can complete those questions, there are about 5 or 6 questions, at 18 months. And if they're concerned about any of those responses for their children, then that's a reason to go and speak with their health provider.
And in terms of answering your questions and observing your child, off screen you were explaining something about the prevalence being mostly with one gender.
Yes, for every 1 girl that's diagnosed, there are about 4 or 5 boys. So we are much more concerned about boys for this condition. So when boys are not speaking, it's one of the things that concerns us tremendously. However, on the other hand, we're finding out that because we're focused on boys, we've been missing some of those girls. So it's important to look at both genders.
All right. Equality, we call it. Gender
That's
equality.
It. That's it.
Starting from the beginning. Professor, is there a definitive cause for ASD?
You know, we don't know the exact cause, but what we do know is that there are 2 likely causes. One is genetics. And so if there is a family history of autism, then you are much more likely to have a child with autism yourself. Bear in mind that sometimes people don't know that a family member has autism, or that family member may have very mild autism that has not been diagnosed. So many times we don't actually know that bit. And then the second bit is the environment. We believe that there are factors in the environment that together work with the genetics. So it's a genetic environmental mix. What we know about the environment is that older parents have a higher risk of having autism. So if a mother or father is older than 35 years, at conception, their risk for having a child with autism is much, much higher. And we also know that children who are born premature or low birth weight have a greater risk of having autism.
And is there any truth behind the concern that vaccines are contributing?
Absolutely not. The one study that was done that suggested that vaccines may cause autism, we have subsequently found that to be a very flawed study, and it's actually been removed from the journal that it was published in. Not only that, we've had more than 100 studies since then that have not shown that autism is caused by vaccines. And indeed, people who stopped giving vaccines, we're now reaping the benefit of that. You see what's happening with measles all over the world now, rising because people stopped giving vaccines.
All right, so because autism is a spectrum disorder, each individual autism is different. That means for every difference or challenge, there are unique strengths and qualities. What are some of the challenges commonly associated with the disorder?
You know, the social skills is probably the most challenging because, you know, persons find it difficult to engage persons who have autism. And it's very difficult also for parents sometimes when children can't speak and they cannot understand what their child needs. And that parents find particularly difficult. On the other side, in terms of the strengths of persons with autism, if it weren't for persons with autism, we would have a very different world today. We now think that many of our very brilliant scientists had autism. And last year, the BBC voted Alan Turing as the icon of the century. He beat persons like Martin Luther King and Pablo Picasso. And at that award, Alan Turing had autism. He died now. He was around. He helped to shorten World War II by cracking the code of the Germans. But he also was the first person who determined that everything in life could come down to 0 and 1, which is the basis of the computer. So at that ceremony, they held up a cell phone and said, every time you use a cell phone, thank somebody who has autism.
Wow. Wow, so he had something to do with identifying the binary code.
Yeah.
Wow.
So persons with autism have minds that think very differently. So a lot of scientific discovery that we now use was done because they think differently.
All right, let's talk about the medical issues now. Are there any associated medical issues in relation to ASD?
Well, there are some medical conditions that it is more likely to occur in. So children with Down syndrome can also have autism and are higher risk of having autism. And persons who have dark spots on the skin, not the regular birthmarks, no, you have to have more than that. It's a big word, we call it neurofibromatosis, but if you have the skin condition that has lots of dark lots of dark spots on the skin, then you are more likely to have autism.
And how does the disorder affect the transition into adulthood?
Children have difficulty transitioning into adulthood. Many of the children who are very mild and are not diagnosed until they're in high school, they get teased and they get bullied because people don't understand them. They are different. The other children know they are different, but they don't know why. And they tease and bully them, and they find life very difficult, particularly in the secondary school setting.
Wow. Wow. How important is it that persons affected by the disorder have a support system in place to help with the effects?
Oh, very important. So your initial support system is your family. And family is really important because family can sometimes give you a break when you need just some time for yourself. Because when you have a child with special needs, you need to get some time for yourself. It's more taxing, and so you need that space. And family can help in many ways, financial, social ways. But also, an important aspect of social support is a parent support group. Because when you join a parent support group, when you've just had your child diagnosed, you meet parents who were there 3 years ago. They've moved on and they can say to you, I know exactly how you feel. This is how I felt too. Here's where I am today. So parent support groups do for parents much more than doctors can ever do.
And of course, they can give you really valued advice.
All the time.
All right. It is said that every 11 minutes a child is diagnosed with autism. What word of advice would you give a parent whose child has just been given this diagnosis?
I would say take a deep breath, get all that support that you have together, and then take the next steps to getting the intervention for your child. We have found that early intervention makes a lot of difference to children's development later on. And the earlier you start the intervention, the better it is, because the brain is developing maximally between birth and 6 years. So if you get a diagnosis, most kids are now diagnosed at about 3 to 4 years, put those interventions in early. Get as much as you can, because it's going to make a difference for you later on in life, you and your child.
Well said. Thank you once again for joining us here on Morning Coffee Guest. Up next, we'll be speaking with Nicola Francis. She's the mother of a set of twins. Stay with us. Morning Coffee Guest. We'll be right back. Welcome back to a very special edition of Morning Coffee Guest. I'm your host, Simone Absalom. With me now is Nicola Francis, mother to teenage boys Tegan and Tegan, who are each living on a different level of the autism spectrum. She's also an active member of the Jamaica Autism Support Association. Thanks so much for joining us, Nicola.
Thank you for having me.
Now, tell us about the twins and when you started to realize that something might be wrong with their development.
Okay. I wasn't really concerned about Tegan's development the concern was with Tegan, because when they were supposed to creep, Tegan was pulling on his tummy. And not only that, he wasn't taking the formula that I was giving him, he would regurgitate it. So I spoke to the pediatrician, and she told me that maybe he's intolerant to lactose. In addition to that, there was no babbling. He wouldn't give you eye contact and so on, while the other one was chatting away, mommy, daddy, and so on. The pediatrician, she wasn't really concerned, but because I was concerned, she referred me to the University Hospital of the West Indies Child and Family Clinic, and from there he was assessed and diagnosed.
All right, so what are the characteristics that were most evident to you?
Okay, for Tegan, as I said, the speech he wasn't speaking. He would line up objects and they're very orderly. You'd lie on his back or sit and watch a fan blade spinning around and around, and I thought those things were very strange. If you walked into the room, you wouldn't acknowledge your entry. Just other things like he liked sameness. So if he's drinking from the sippy cup, he wants to drink from the same one all the time. Things like that.
How were they diagnosed? Tell me about the experience at the UWI.
It was, I think, I'd say it was traumatic for me, because I had high expectations for my kids. So, and prior to diagnosis, I knew nothing of it. I wasn't even aware of that word. So upon diagnosis, I actually started to cry. It was on that same day when they had that earthquake in Haiti. Professor Samms-Vaughan instructed me to join JASA, that's Jamaica Autism Support Association, which I did, and from there I got some support. I went online, I did my reading, I watched videos and so on, and that really helped.
Do you think autism awareness needs to be improved on a national level?
Definitely, because a lot of the issues we're having is because other persons are not aware of it. You go out into public and he might start acting up because he doesn't deal with crowds very well. So he might start acting out, and of course, it's going to attract stares. And that is very uncomfortable. But if other persons know of it, then they would understand what is happening. They would be able to empathize with you and make it easier. You
said both of them were showing characteristics. Tell me about the other twin.
Tegan, I wasn't concerned about him. It was upon Tegan's diagnosis that Professor Samms-Vaughan said to me, because they are twins, both of them are usually affected. So she advised me to get Tegan tested as well. And he was tested at the School of Hope, Randolph Lopez School of Hope, but he was diagnosed as being high functioning. So he went to a regular school and so on.
How old are they now?
They're now 13 years old.
13 years?
Yes.
When we're talking about awareness on a national level, it got me to think about the awareness in their schools, in their social environment. What are some of the observations that you've made?
Okay, awareness at the school level is quite lacking. Even though they talk about, ministry might speak about inclusion. I don't think there's any inclusion. The child is just in the class, like an appendage. They're not included in what's happening, because let's say his class is conducting devotion. He's not a part of it. If there's some performance, he's not a part of it. That's not inclusion. So I think more attention, we need more awareness. Maybe teachers need to be retrained or something in order to make their lives easier.
And in a social setting, do they go to, I don't know, church and parties, stuff like that?
They do go to church occasionally, but because of Tegan's issues, I hardly go. Because he doesn't deal well with crowds, so he might start acting out, making sounds, and so we call it stimming. Persons will start looking around and so on, and it's uncomfortable. Most times I just go outside and listen from there. So it's not really enjoyable for me, because I have to be attending to him rather than listening to what's going on.
And that's a lesson for parents as well, because in Jamaica we just say that child is rude.
Right.
But it's deeper than that.
Right.
It may
They're
be
not
deeper than
rude.
that.
Right. They're not rude.
Wow. Wow. Definitely a lesson to take away. You said you joined the JASA.
Right.
Tell me about that experience for parents who are out there who are dealing with these issues and looking for that group. What was the experience like, or what has it been like?
I was lost before JASA, and honestly, there are persons in this organization who have been there already. So my children were newly diagnosed, but then there were persons there whose children were diagnosed years earlier, so they would have gone through some of the things that I'm just now experiencing. I was able to pull on their experience in order to deal with my issues.
For example?
For example,
You said that he was stimming. How did you find out that he didn't deal well with crowds and stuff like that? Was it from another parent? Those kinds of things, would you get that information from another parent in the group?
Yes, along with YouTube videos.
Oh.
That helped a lot, because other persons, they videotape what their children are doing and they speak about it.
Wow. So they're available when you're a part of the group. You have is it like a WhatsApp group, or can you call on somebody and say, listen, he's doing this and I don't know what to do? Is it that kind of experience that they get? We
have a WhatsApp group, and you can post questions there and other parents will answer.
Wow. Yes. That's nice. That's nice. How has the experience changed you as a person, as a Jamaican?
Well, I'm definitely more tolerant, more patient. I'm more accepting of the small things. So when he meets those small milestones, for example, when he was able to tie his shoelace, I posted it in the WhatsApp group, and I was so excited, and all the other parents were excited too, because they understand. With the neurotypical kid, that is normal. Tying your shoelace, brushing your teeth, learning how to take a shower and so on. Those things are normal for other kids. We have to directly teach our kids how to do these things, and small steps at a time. So you don't teach them how to take an entire shower. You might teach them how to soap the rag first and so on. So it's small steps.
Really inspiring. What is your word of advice to parents who are going through a similar situation?
Word of advice, 2 words: intervention and support. So seek help for the child very early, because it can make a lot of difference in that child's ability to function as close to normal as possible, and seek support from others who are going through the same things that you're going through.
All right, thank you so much for speaking with us, Nicola.
You're most welcome.
Your story is truly inspirational and has certainly helped to increase the awareness of autism spectrum disorder. This has been PBCJ's Morning Coffee Guest. I'm Simone Absalom. Thanks so much for watching.